Hello viewers, friends. Once again, you are welcome to my YouTube channel. I remain your humble friend on YouTube, Obichukwu Daniel Aniekwe. I'm a medical doctor by profession. You can call me Dr. Order, the doctor in the house, the doctor that is closest to you, is in every home, man, to give you information on health issues, to give you the right information on health issues. Now you know where to come to get the right issues on different health issues. Okay? So today I am going to be discussing on correcting another wrong information on the topic I called diaper rash. Because I have heard so many things about diaper rash, or discoloration at the at the perineal region, the buttocks, even on the neck. I think very recently a couple came to my clinic with their baby, I think about 3 months old baby, and they were like, there's this discoloration, and I told them what it is that is due to diaper rash, and they said it's on the neck. Oh, what is it now? Is it because of the diaper again? I said no, it's simply because infants at that stage still have what we call short neck. Their head and their shoulder is almost touching. You can barely notice the neck. The jaw will be touching on the almost on the shoulder. So there is this heat around that can bring this discoloration. The woman was now asking me that they said, my neighbor said, this person said, it's because of what I eat. I said, things like what? I said, because of milk, because of different food I eat, that I should stop eating. They mentioned a whole lot of things that I can't even remember to mention here and now. That it may be probably why she's having the rash. I told her no, that is because of the diaper. Actually, some people react to the diaper. That it can also be due to the fact that you don't change her often, especially when she soils her diaper. The urine is a chemical. It contains some, chemical in it. Even the feces. You understand? Yes. So when these children soil their diaper, and the mother or the caregiver did not notice on time to change it, it can cause such discoloration at the perineal region, even on the buttocks, like I told them. So you need to understand that these things are medically proven, scientifically proven. It is not true that because of the food you are eating as a breastfeeding mother, that is what is going to cause rash or diaper rash or discoloration on the perineal region on your baby. Stop listening to all these unfounded theories and things people are talking. I call it street knowledge, street talk, unfounded. Because once you ask them, they will tell you that that's what they said. That's what everybody said. Oh, sorry, my dear. It's not everybody that is saying it. Okay? So, and I told her that, they now asked me, what are they going to use to treat it? I said, one, it's just for you to have the knowledge. One, change this child often. Change the child often. Time to time, at least, open the diaper and look into the diaper. Some mothers smell it, some open it to see whether the child has wee-weed or has poo-poo, so that once you notice it, maybe if you check this child every 1 hour or 2 hours, just open the diaper and check. You will now know that the child has soiled the diaper, and you change the diaper. But if the child has not soiled the diaper and it is up to 4 hours, you can change the diaper to reduce discoloration of the perineal region or diaper's rash. That's what I told them. And I said, okay, 2, you can also use Vaseline gel on that region. You can use powder, baby powder. There are different good baby powders. I'm not here to advertise any product. If you want me to advertise your product, you tell me. We'll talk about it. You understand? So then on the neck, use powder to rub the neck to reduce heat forming there. Because once heat comes around there or the perineal, bacteria can come there and settle after some few hours and cause that. Okay? So that's the simple thing to do. That's the simple thing to do. And of course, there's another one they told me about the discomfort, abdominal discomfort in children, especially in infants. Around that 2 months, 3 months, going forward, abdominal discomfort. What do? You see mothers, especially first timers, first timers, those that are just having their first child, being confused. People used to give a whole lot of things. They will tell you again, it's because of the thing you eat. When the child sucks it, you start having stomach pain or stomach discomfort, start farting, and all that. Actually, at that stage, the GI is resetting. The liver, around that 3 months of age, has started producing enzyme and moving them down to the GIT, gastrointestinal tract, the small intestine, the large intestine, start preparing them for digestion. Nature is wonderful. God is gracious. Nature don't rush his thing. Nature has already known that this child will one day start eating adult food, maybe in the next 3 months or in the next 4 months. And nature will start, the body will start preparing itself for that work that is coming. Because some parents might start, introducing other feed, maybe after, 5 months, even some at 4 months. But what we teach as medical doctors is 6 months. That is after you have done baby-friendly breastfeeding. You understand? For 6 months, for first 6 months, exclusive breastfeeding. So the body will start preparing itself for that day. That day when the child will start eating every other food, adult food, gradually. So the liver will be secreting some enzymes and some chemicals into the GIT to prepare it. And it can be discomforting. My discomfort. You understand? So it is not out of place. It's also a normal physiology. That something is normal in nature or in life does not mean it will not come with some level of discomfort. No, but that discomfort will not, be so outweighing to be termed a disease or an illness. You understand? So that is the truth. That is the fact. So what can you do? You can simply allow it to go, to run its course without any intervention. Okay? You can give simple pain relievers like paracetamol. There are other drugs you can use like, nospamin. Some people give nospamin. Some people give grape water. You understand? But it's not something to start panicking or something to start postulating that it is what you are eating as, a breastfeeding mother that is making your child to have that problem. No, probably she's getting it from the breast milk. No, it's true that it's not. No, breastfeeding mothers cannot. A breastfeeding mother cannot take anything he or she will lay his hand on, especially drugs. We know that, but not because that you eat your normal food that will make your child to start having abdominal discomfort. No, it is the stage, he or she is at that time. And I have told you what is happening, how the liver is preparing, the body is preparing for the future. Okay? So now you know it. Please help me to disseminate this information. Let our people have the right knowledge and do the right thing. Let nobody confuse you, deceive you, or take your money unnecessarily. Because even simple water you can give to the child, or breast milk at that stage, at that stage, give breast milk. Give breast milk, or you can give grape water, or you can give nospamine. Once it stops, you stop the grape water or the nospamine, but continue to breastfeed your child as much as you can. So now you know. Go ahead to practice the right thing. Go ahead to tell people the right information. And if you're one of those that have been saying all these misinformations, please, now you know, stop it. Save a child, save someone's life by saying what you are sure of. Okay? Yeah, I thank you all for listening to my video. I would like you to please like my video, okay? Comment on it, share it, okay? So that others will see it and benefit from it, okay? And as much as you can, just press on the notification button so that once the new video comes up, you will, be able to access it, to be notified on it. Thank you. Have a wonderful night. God bless you. Good night. Love ya.